Hello, everyone, and welcome to this episode of Wings Podcast. This is your host, Milind Agnihotri. On today's show, we will meet Dr. Medini Kagali, who is a naturopathic doctor by education and a holistic diabetes physician by profession. She is currently amalgamating novel holistic concepts to help individuals with diabetes and obesity achieve optimal well-being. In addition to her medical practice, Medini is a keen enthusiast of organic fine dining and aesthetic clothing. This takes us back to our roots, and that's what naturopathic principles are all about, she says. Welcome, Medini, to this episode of Wings Podcast.
Hello, it's lovely being here, and I'm so excited as this is my first podcast. So I'm really happy to be sharing my journey so far.
Thank you very much for coming on the show, Medini. And, from the introduction that I just read out of you, the 2-3 words caught my attention. You say that you are amalgamating novel holistic concepts in healthcare, specifically diabetes and obesity. Now, what is this amalgamation? What is this holistic concept?
Yes, so I've been asked this question a lot. In fact, everyone who come across, and ask me, what have you done in your career? So I tell them, yes, I've opted for holistic medicine. I've completed my naturopathic medicine. So the very next question that they ask me is like, why holistic medicine when your family is completely of, who have studied allopathy medicine?
Mm-hmm.
So there where I got my interest, and holistic means treating person as a whole. So we're not just treating the person based only on symptoms or any signs. So we are literally eradicating the root cause of a particular condition and treating the person as a complete being, because every being is quite complex. So we go to the deeper causes, eradicate the root causes, and treat the person. So this is all about holistic approach.
And when and how did this interest, got generated for you? Because I know you were born of some very successful doctors in Pune who are our very good friends, and they are our doctors too. And I'm sure growing up in a home where medicine is talked all the time, you have your parents have your own hospital too. So was becoming a doctor always your dream? And how did this all process start for you?
Yes, so ever since my childhood, I've always been attending conferences or symposiums or, some kind of get-togethers where always I was surrounded by doctors, including my parents and my elder brother. So the way they used to talk, even though most of it used to go above my head because I was quite young at that age to, grasp so much of knowledge.
Mm-hmm.
But whenever I used to hear them, I used to feel so inspired. Oh my God, they're doing such a noble cause by, treating human beings, helping them get better with their health. And I think, as everyone knows, that after the pandemic has hit, everyone has started prioritizing health so much. So since then, since my, going back to where I started, so since a very young age, seeing all the elders around me and, being tagged along and hearing my father speak on the phone all the time to the patients. I mean, he's always advising them what needs to be done, what's the line of treatment. So I think I always knew that I wanted to become a doctor since a very young age. But I would suddenly, when I was in my 11th and 12th, I started feeling that why not integrate all the streams of medicine. Medicine is a very huge topic. It has a very broad spectrum. So I wanted to do something completely different. Of course, I'm not saying that allopathy I'm against allopathy or something of that sort, but I wanted to go in that lane of a very holistic and integrative approach where all the streams of medicine come together to treat an individual.
No, you're right, because I think over many decades and probably a few centuries since scientific medicine has been discovered, I think complexity and specialization has only improved. Of course, with improved knowledge of human anatomy, whatever little I understand of it as a lay person. One probably today knows so much more about every part of human body that you could actually specialize in only one type of medicine. That's why we have so many branches. And
Exactly.
I do remember, when I was a kid, we had just had something called a family doctor, and
Right.
he would listen to us and he would ask questions. What were you doing last week? What were you doing yesterday? Listen to all our stories, and then he'll give some liquid and he'll say, okay, go. And 2 3 days later we'll be okay. So I don't know, is that what you're talking of, holistic, where you actually get to know not just the about the ailment but so much more about the person itself, what the person is going
Yes.
through? I don't know, I'm just wondering.
That. I think you're right. I think the doctors in the earlier ages used to give a lot of time. I think they were better listeners back then.
Mhm.
Right now, people just want to, share everything that's going on. It's become a very hybrid kind of lifestyle that we're living. So I think the more we listen, the more we talk, how the treatment is done there. So, talking to the person and trying to understand what the person is going through and having that sense of empathy is very important. Right now, the consultations that, of course, doctors have become quite busy. So the consultations are hardly for like, 5-10 minutes max, not more
Correct.
than that.
Correct.
But in earlier days, people, the doctors especially, used to literally ask you in depth, like what exactly is happening. They used to have physical examination, not just lab tests. So they used to literally use the hands to, examine your abdomen or use a stethoscope to check your chest and all the parameters. But we hardly have that, now in so much of detail. So I think that's where we are a little bit
And
lagging, but
is this what
definitely.
you underwent in your BNYS course, which is the Bachelor's in Naturopathy and Yogic Science, and it's something very unique and very different, especially the university that you went through.
Yes. So I have really nice sweet and sour memories with my undergraduation. Actually, uncle, as you know that, I was in like cocoon until the age of 18, and all
Ye-
of a sudden I had to move to a different state. And that too, it was in Bangalore, though Bangalore is our hometown. I felt at home definitely. But then we had a very different kind of lifestyle over there. My typical day itself started at 5 a.m. and we ended by 6 p.m. We used to have an early dinner and we had a very sattvic kind of lifestyle. When I say the term sattvic, no aphrodisiac kind of food, very fresh, homely cooked meals and all of that. And we had a lot of research as well, a lot of medical subjects. And each year, so my entire course was for 5.5 years. So each year was really a memorable one. So I think we had a lot of practical exposure as well. So like any other MBBS student, first year was for dissections where we saw bodies, we examined them, and we got to know about the anatomy, physiology more. But along with these subjects as well, the medical subjects, we had naturopathy and yoga backed up with a lot of science. So SVASA University is one university, which is the first university in India to provide courses. And our chancellor, HR Nagendra, he was actually a scientist from NASA. So his interest grew in yoga. So he's also done tremendous amount of work in the field of yoga and naturopathy, which is really amazing. So it really helped us, explore and widen our horizons in the field of research, especially.
So as there's so much is written, Medini, about allopathy and naturopathy and yoga and all that stuff, and of course gets to read a lot. But then, as a practicing doctor, having looked at allopathy very closely, and of course gone through a formal 5.5 year education in naturopathy and yogic science, if you were to pick one or two fundamental differences in these two approaches to human health, what would they be?
I think the basic fundamental differences with allopathy, it's more of just the use of medications. I'm not saying the use of medications is wrong.
Mhm.
Definitely, we need medications to, further stop the complications of any condition. Whereas complementary medicine, what I'm doing, holistic approach, has includes everything. We are not against medicine, so we use medicines along with complementary therapies. So there are so many therapies that we have. We give a lot of importance to modern nutrition, traditional nutrition, naturopathic nutrition, as well as of different forms of bodily movements, exercises, and yoga. So that's more of a broader spectrum, I would say. So that's one main difference. And the other being, I think allopathy and is a lot to do with surgery. So holistic medicine and integrative doctors don't really are not surgeons by profession or cannot perform surgeries. So that, I think that's the difference. But of course, palliative care and all is necessary, which is a common factor for both of them.
So how have your thinking evolved over the 5.5 years that you were at SVyasa University, in terms of when you started, and when did you kind of get a sense of who you want to be or what you want to do in healthcare?
To be honest, I was that frantic in my first year. I didn't know what to do because everything was so new to me. The lifestyle, especially waking up at 5 a.m. And then I used to, talk to my friends from Pune who were typical, medical students or engineering. So their lifestyle was completely different from what I was going through. So I was in this state of confusion, like, am I doing this right? And because that time, naturopathy medicine was not so common. So we just had 40 of us in a batch. And by the end of 5.5 years, we were just 20. So few dropped out, few couldn't clear the exams. So I was literally doubting whether I have opted for the right, career choice, whether I have made a right choice. That was in my first and second year. Then second, third, fourth year, when I had more practical exposure, we had really interesting subjects, I must say. So in third year, we had this practical in nutrition. Okay, so I literally felt I was in MasterChef or something. So they had given us a case. So I had gotten a case of that I have to cook a entree and a main course for a pregnant woman. So how much calories she needs to take, and we had exactly 90 minutes to prepare the meal. So I was like, oh my God, I'm in some competition. So we went, grabbed the ingredients from the mess kitchen, which we had never seen. So
Yeah.
that was so exciting. And the first time, that was the first time I was actually cooking. So I had to literally call up my mom to ask her, how is this done? So I was typically making a chia pudding with a ragi roti and, chutney and all of that. Ragi is basically
Yes.
finger millet.
Yes.
So all of that. So the ultimate, it looked really good, but then the ragi roti, which was really hard. So I kept purposefully the softer ones on top and the harder ones down, so that
Yeah.
the tasters, the judges, and my the viva takers don't notice it. So such nice experiences that we've had. So that's actual, complete medicine, I'd say. So there, my interest really grew stronger in terms of hydrotherapy also. So we had a lot of exposure of hydrotherapy. So hydrotherapy is self-explanatory term, which is called
Hmm.
as water treatments.
Hmm.
So we had this practical exposure of, going for jacuzzis and spinal bath and hip bath and all of that. So it was one way quite, a luxury for all of us.
Hmm.
So there my interest began, and I felt that yes, when we saw patients, so we had a lot of patients. So patients is a little kind of a negative term. So we used to call our patients participants, whoever used to come to our
Correct.
university. So my university is also attached to Arogya Dhama. That's a hospital.
Yes.
So we saw so many kind of illnesses like cancers and neurological conditions, which people thought that it is irreversible. But when I saw them not just take medicines, but also undergo treatments like mud therapy, hydrotherapy, chromotherapy, magnetotherapy, and in such a comprehensive manner, I was surprised. A person who was in a wheelchair was able to walk within 2 to 3 weeks, a span of two to 3 weeks. So, I mean, all kinds of therapies, including medications, are so powerful. And of course, ultimately, that person also needs to have a good amount of willpower, to get
Of
better.
course.
So all that plays a very important role. So as and when throughout all these, little by little experiences that I had in 5.5 years, I realized, okay, so I'm pretty strong, I'm confident what I want to do. So in my internship days, I think my interest grew. I was more inclined to metabolic conditions. So
Mm-hmm.
I wanted to specialize in lifestyle disorders, which were not very common back then in the olden
Yes.
days. So metabolic conditions like diabetes, obesity, PCOD, hypothyroid, hypertension, which is so commonly seen in so many of us. So I think I was more inclined to take up diabetes. So that's when I wanted to pursue my further education, typically in diabetes alone.
And then you went to the University of Southampton in the UK.
Yes, yes. So that was a complete, game changer for me, because being in India for 5.5 years with, all this kind of environment of holistic approach and all of it. But to my surprise, when I went to UK to pursue my master's in diabetes, that time I realized that even the UK, the NHS, so the NHS is the National Health Services,
Yes.
gives so much of importance to holistic medicine.
Yes.
And the Queen itself, I mean, touch wood for her, the life that she's living right now is because of holistic approach. So
Uh-huh.
she's very much inclined towards holistic medicine as well. And people were there, even the nurses, the doctors, the allopathic doctors, as well as surgeons. So they're quite inclined towards the concept of holistic and integrative approach. So they
Mm-hmm.
all have huge multidisciplinary team. It's not like where in India one doctor does everything, like checking the BP, giving the medications,
Mm-hmm.
giving signing up for the lab tests. There, every person is assigned a particular job, so they act and they perform as a whole team. So that was very interesting for me to see. So I learned a lot in my span of 1 year and 6 months almost.
Mm-hmm.
So it was good experience altogether.
And unlike being in Bangalore for your BNYS at SVSA, which of course was away from home, but you were still very much in India. Whereas here you are
Yes,
like so far away, and I think it happened to you
true.
just around or before the COVID days, right? I mean,
Yes, so in 2019, immediately after my undergrad, I took a 5-month gap. So I was at home with my parents, and then I decided, I should pursue my further education in diabetes. So yeah, going out of India, I think made me only stronger because I was already away from home for these 5.5 years.
mm,
So I never felt that, homesick or anything when I went back to UK. People were very warm, and I quite liked the culture as well as the importance that they gave for holistic education, medicine, and all of it, which was very interesting.
apart from education as we grow up, Medini, and it happens to all of us. It happened to me as well. I mean, you left home, at the age of 18, as you said, living in a cocoon before that. So was I, and so are many young people all over the world. You
Right.
leave home, and then of course you pursue some education, some graduation, whatever it may be, and then of course you went on to do your masters in the UK. But apart from uh, academic knowledge, there is something else that we also imbibe in us. I mean, I can tell you a lot. For example, when I did my engineering, for which I left home, uh, in the 5 years of engineering that I did, there is so much more than engineering that I learned. From the age of
True.
17 to 22, as such. So, what parts of Medini did you end up discovering through your undergrad 5.5 years and your masters in the UK? If you look back and say, okay, these are the discoveries, a little things about me that I found on my way.
Yes, so my undergrad was like super long, but I have had some really nice experiences at a very young age. So in my second year itself, we had this conference where the Prime Minister of India, Narendra Modi ji, was about to come
Mm-hmm.
to as a chief guest. So we worked very closely with the PMO. So all of that was a completely different side of me. It had to nothing to do with the academics, and we also got the chance to meet Sadhguruji and all of it. And yes, we had our own mischief events that we used to do, like sneak out and all of that. So yes, in ways I discovered myself that you leave me even in a jungle, I can sustain. So becoming independent was something that I learned very strongly, I
Mhm.
think. And I had become, I had, I was able to take decisions for my own self. So I had not to be too dependent on anyone for anything. So I think that was one side that I learned. And also besides academics, I loved, participating in fests and all of it. So that part of me where, we used to perform, we used to anchor, we used to host, and we used to take up quizzes and also a bit of dancing, different styles, all of that. So I think that bit I'll never forget. And throughout the year, we had different experiences where we used to go for trips and organize conferences ourselves through the university. So this was not just academic based; it was like overall, fest that any college that has overall in India. So it was
And
those little moments that.
what about the UK experience? How did that uh, shape you into what you are today?
I think travel changes everyone.
Hmm.
So the culture, the travel, the food, especially being independent and doing everything by yourself. Unlike here, where you have some help whenever you need, let it be for cooking or cleaning or plumbing or something or fixing up a Wi-Fi. But there you have to, you're all by yourself, you just maybe have YouTube because you have free Wi-Fi to check on what exactly needs to be done when. So I think yes, UK also was a very nice experience. I'm a very party person. I love attending, going for parties, and knowing the culture, trying different cuisines. So all of that way also was a good experience. But I couldn't explore much because the pandemic had just begun in like 2020 when I was just ending my masters. But overall, yes, the different culture, not only England and Indian culture, there were people from China, there were people from America who came. So that multicultural aspect, I really liked. I enjoyed it.
Medini, youth is one such a beautiful phase in one's life, and even at this age and stage in my life, I cannot forget the fun we had during our engineering days in the hostel, and you know uh, participating in college elections and all kinds of things that go into it. And in hindsight, I see that there is tremendous amount of freedom that is available to oneself, to the extent that you could actually do anything. There's nobody stopping you. Yet,
Right.
somewhere you also realize that that freedom does come with a sense of responsibility to
True.
yourself, to your parents, and to your own life, and ends up you end up setting certain boundaries in that sense. So I've always explored these notions of freedom and boundaries together. Freedom allows me to be who I am, express myself, do what I want. Like you say, you love to go to parties, etc., etc. So party, have fun. Yet you believe in boundaries because the boundaries essentially protect you. They ensure that
Definitely.
you remain safe and secure. So I don't know, over your growing up age, how has this concept of freedom and boundaries manifested for you? How have you knowingly or unknowingly engaged with these two ideas or concepts, which are so important as a part of one's growing up, isn't it?
Yes, and somewhere it's a very big role I feel about of one's upbringing. So my parents have always given my elder brother and me, the freedom of choice to pursue whatever we want, to explore things, to experience different stages in life and all of that. So I think somewhere when I was in my undergrad and postgrad both, of course in undergrad we didn't have a lot of exposure where, because I was living like in the university itself. So it was in campus, on campus, we were supposed to live there.
Mm-hmm.
So there I felt that yes, we have sneaked out and done stuff, but then we also always had that sense of responsibility. Like we had our limits, we knew what was right, what was wrong. So that way it molded us to be a better person. Same goes when I went back to UK. I didn't feel okay. Now I'm a free bird. I
Mhm.
can do whatever I want. So it was not that mindset wasn't there. We knew that okay, we have to go for party. Next day we have to come back and sit and do our assignments because they have an assignment system there.
Mhm.
So I think I came to know what was my freedom and boundaries, my limits, and I always kept a balance of both. So
And and
that's
and I don't know. I mean, does it play out differently for girls, unlike boys? This.
yes, definitely. Definitely, definitely. So I think boys have much more freedom, but I feel they also have some sense of, responsibility. It's not just, girls have some limitations. I'm sure even boys, but yeah, if we compare, definitely the boon is greater on the guy's side.
So you have something to crib with your brother. So that you had a little advantage which I didn't have.
Yes, of course, completely.
Uh,
He is the extrovert who loves to travel, loves to explore.
yes,
So I think we are poles apart.
absolutely. So tell me one thing. There are these three amazing people who have been a part of your growing up years. I mean, within the immediate family. I'm talking about, your father and your mother and your elder brother, all three being doctors. If there is one
Yes.
thing that you've picked up from each one of them, what would they be?
Think what I take up from three of them, I would like to begin with that. So, from my mom, she's the best critic. She'll exactly tell you because I'm a very overly optimistic person. So,
Okay.
she's the one who holds me back and says, don't be too optimistic about everything. So, she's the best critic in the house. I think every mom is, but yes, she exactly says, what needs to be done and what shouldn't be done. So, I think that is what I pick up from her. From my dad, he is so patient. I am completely opposite. I think I lack patience. He's so patient and he's so calm. And I love the way he has a grip over any situation. He exactly knows how to tackle it so well. I think that's one thing that I love to pick it up from him. And I'm still learning. I'm still learning.
Hmm.
And from my brother, I think I'll say life is limitless.
Uh,
Just explore and,
जिंद-
experience everything possible.
जिंदगी
So
ना
as an
मिलेगी.
elder brother,
Yeah.
so as an elder brother, my brother used to always say, he's like, "Are you seeing someone?" I'm like, "No, I'm single. I'm not seeing anyone." He's like, "What? Yeah, I mean, you should explore. You
Uh,
should have a boyfriend. This
uh,
and that." In fact, I had my first drink that
uh,
was a beer with my brother. So
okay.
he was like, "I'll take you out for a drink." So he
Wonderful.
didn't want me to go into any peer pressure and people get influenced, right?
Yes,
Like
yes,
do
yes.
stuff which are not meant to be doing. So
Yes.
he's the one who first took me, and he was like, you should experience everything, but with the right set of people. So I think that's what I pick up from my brother.
Wonderful. So he's your Anna and your first friend too.
Yes, I mean more than me sharing anything, I think he shares everything and much more beyond that with me.
Absolutely.
So yes.
Absolutely. Medini, after your undergrad education in India and your masters in obesity in the UK, you now work and help uh, people having diabetes and obesity through a holistic approach. So, what is it that you actually do here? What is this organization that you work for? And what have been some of the memorable experiences you had in this practice that you do in this space?
So I work for Freedom from Diabetes, which is an organization in Pune, and the owner and founder is Dr. Pramod Tripathi. So I went through this organization by Dr. Malhar Kanla, who's a part of the organization as well. So I came to know about this organization through my parents itself.
Mm-hmm.
So they have been hearing about Freedom from Diabetes since quite some time. So they just questioned me, why don't you give this place a shot? Maybe you would like working here. So I enrolled, submitted my resume and the covering letter and all of it. And then immediately I was appointed as a lead transformational expert. So here at Freedom from Diabetes, we have a holistic transformation program that goes on for 1 year.
Mm-hmm.
We help people with diabetes and other comorbidities like obesity, hypertension, PCOD, and hypothyroid reverse their condition.
Mm-hmm.
So just not reverse, but also transform their lives into a much more healthy human being. So I've had many memories. It's been more than a year that I've been in this organization. Recently, I've just got promoted, and I'm a part of the training department. So what we do is train the new joiners and the current employees on their knowledge on diabetes, also their approach on how they need to, give the treatments for the customers that we get. So here also we call our patients not as patients, but we call them our participants. So yes, the amount of work we do, we don't realize it while we're working, but I think the feedback that we get from our participants is really heartwarming, because we've seen people prick their fingers with insulin and take so many medications, not only for diabetes, but for other comorbidities as well. So I think once that relief that they have, that they're off medication, they're off their insulin, is something that when we witness it ourselves, we realize that, wow, I mean, this is such a noble cause that somebody is doing. And here also in Freedom from Diabetes, we work as a multidisciplinary team. So there's a diet department, there's an exercise department, there's something called as the inner transformation department.
Mm-hmm.
Basically, inner transformation has a lot to do with our mental health. So
Mm-hmm.
there is journaling, there are positive affirmations and meditation and all of that as well. And we have somebody called as mentors. So mentors are nobody but the old participants who are currently helping the current batch participants to with the program. So 1 year is quite a long period, right, to sustain and to bring about a behavioral change in your lifestyle. So I think this step-to-step approach, this entire holistic transformation program, the HTP program, that's what we call it as, is a very extensive program. Also, the results that we're getting right now and the joy that we see that, they can actually go back eating what they like, and they learn so much not only about what they should eat or how they should work out, but it's beyond that. I think we cannot measure it. There's no measurement for it. It's not only about the numbers, like it's not only about your BMI, it's not about your weight, it's not only about your sugar numbers, but it's much more. I think it's the approach towards one's life is completely changes. And I think what we're doing is really good. The feedback which we get says a lot more than what we do on day-to-day basis.
Let me ask you a very personal question here. I mean, simply said, do we take our physical body too much for granted? Or let me be very crude in my use of words here. Do we abuse our body in the way we live our
Yes.
life today?
Yes, definitely. I think we are all living a very fast-paced life. So earlier it used to be like at least one member of the family used to cook meals throughout the day, like proper home cooked meal. But here, I think everybody is earning in the family, everybody's on the run, running errands. There's
Mm-hmm.
nothing like, we always choose for packaged food, or we, do not give so much importance of to physical health like exercising,
Mm-hmm.
and we eat whatever is like on the go. So I think we always underestimate how much we eat, and we overestimate how much we work out and we
Mm.
exercise.
Yes.
So I think that's where we are lagging behind. And also, if there's any function or gathering, or even if you want to catch up with a friend for a coffee, one thing that's common is food that
Yes.
gets people together.
Yes.
And to be honest, there are not many cafes or restaurants where they actually serve as, organic, good sattvic food, or, which nourishes us. So it's always this hybrid kind of food that we eat. So somewhere definitely we are abusing our body. Not that I'm saying that I have a perfect lifestyle and
Yes.
I'm leading a very good lifestyle. Nothing of that sort. Of course, it's difficult in today's times. But I
Yes.
think as much as possible, we should try to, understand what we're eating, because everything is customized. You cannot depend on a gym instructor or a trainer or a dietitian or a nutritionist to customize your meals, because nobody knows your body better than you do. So you can't keep relying on other people's opinions always. So I think listening to your body very closely is what I feel. And if
You
one
know,
realizes it, that they're abusing their own body, then I think they're way ahead.
no, actually, Medini, this happened to me many, many years back. I met with a very crazy accident for which I was in bed for 6 months. So one of my lower vertebrae has a compression, and it's a permanent damage. There's nothing that can be done about it. So at that time, there was two options. One, to do something called a microsurgery, and try and get it up and going. Couple of MRIs showed the defects, etc. The doctor said, okay, we can get it right with a surgery, but there are complications because very close to the spinal cord. And the other option was just lie in the bed. And I took an advice of a very old school orthopedic surgeon. He was 75 years then. He had ended his practice almost a decade before that, but he was just kind of coming around, and we were talking. So I showed him my X-rays and MRIs, and I was in severe pain. So he asked me a very simple question, in my very first visit. By the way, he charged me only 350 rupees for consultation, which lasted for 45 minutes. Okay, a orthopedic surgeon with 45 years of experience. He said, Milind, tell me one thing. Does the lion in the jungle, when he goes for a hunt, does he fracture his foot? So for a moment, I didn't understand the question. Okay, so I just kind of scratched my head and I said, yes, maybe, because the hunt is wild. The lionesses hunt. The lions don't hunt, but the lionesses hunt. And they run very fast. And of course, they would have a fall and they would break some limb of theirs. So I said, yes, doctor, I think they would have a fracture sometime or the other in their life. So he says, which doctor do they go to? So I said, of course, there are no doctors. I said, what would they do? He says, you do tell me, what do they do? I said, probably, I don't know, maybe just sit under the tree.
Heal by itself.
And he says, yes, they exactly sit under the tree for 2 months. They cut down their diet, food comes to them, they'll eat a little bit, and the body heals by itself. So he said that, if you want to trust your body and if you believe the body will heal itself, just lie in bed for 6 months. And those 6 months, Medini, were extremely transformational to me, because at every level I had nothing to do. I couldn't even move an inch. I had to look up, to the ceiling, lying on my bed. I was not even allowed to move one side or the other. And all the time I was just observing and listening and doing, and the body actually spoke to me. A lot of things happened. One, non-vegetarian food stopped all by itself. Alcohol stopped. I mean, I used to, of course, be a social drinker. I would take an occasional scotch here and there, but for some reason, and and somehow my eating habits. So today I'm a 2-meal person a day. Not because of this thing called intermittent fasting and all. I don't know all that, but it has just happened over the years, and I know what it does. So you're absolutely right. I mean, if one listens and respects, the body can take you a long distance, isn't it?
True, so rightly said. In fact, I was so surprised during my undergrad. So in 2017, there was a Japanese scientist. So he was a biochemist who won a Nobel Prize for autophagy. That's for fasting. And we've been talking in our Indian philosophy and texts and, the different mythologies that why fasting is so important.
Absolutely.
So I was so surprised that, wow. So, you just put the simple things in a very fancy way. Of course, he definitely had a lot of funds to do the studies and all of it on autophagy. So it's amazing how the body works when, you just let it heal by itself.
Yeah, as they say, if you allow, if you get out of the way and let the body do what it wants to do, you'll be a much healthier person in that sense. So Medini, tell us, I mean, you've come fair bit of distance in your life in terms of getting yourself, professionally educated and practice. So What is in store for you for your future? What is it that you look forward for yourself?
I hope my dreams are not too tall. So I think I would like to continue in the same field that I am in currently, and with the holistic healthcare which is evolving at such breakneck speed. I think I would like to continue in this. Like as I said, that we started with just 40 in our batch, and we were eventually just 20. And then now the enrollment of my juniors, it's around 150 in a batch.
Wow.
So I think holistic medicine is really growing, and I would like to continue the same. And of course, my one of my dreams is to change the eating patterns that we have here in India. I think we are too dependent on only carbohydrate diet. Of course, because even our DNA structure is as such, the regional food that we get. I'm not saying it's bad, but like we have Swiggies and Zomatos, but where do we have those food where they provide us with healthy, nourishing food? So I
Mm-hmm.
think that bit I would like to change, would like to get in more healthy kind of restaurants and cafes that would provide nourishing meals.
Mm-hmm.
That, and like any millennial, a very cliche dream that I would love to have my own cafe, an organic one that celebrates Indian roots and also Indian handlooms and fabrics, a very
Mm-hmm.
small boutique next to it. And all these little treatments like reflexology, mud therapy, all of that. So that's sort of a cafe that celebrates the roots of India.
What's the name of the cafe? Have you thought about it?
No, not as such. I've not yet thought of the name, but
Oh.
yeah, thank you. That's like you've seeded something in my brain now. I have to start
No,
thinking about it.
absolutely. And I'll be probably one of the first few customers to walk in there and enjoy this. But
Definitely. I think it's very early to be saying all this, but yes, I think everybody has their set of dream, and I want to bring about some, change in the system of how we eat, especially because that's like 80% of the lifestyle that we lead, excluding the physical, that's the exercise bit, and the taking the stress bit, excluding those two. And yes, I'm still at my budding stage of my career, but in the long run, definitely this would be one of my dreams.
wonderful, wonderful. Medini, what a wonderful, beautiful conversation this has been into a very different world of the world of naturopathy and yogic science, and looking at a holistic approach to human health and human condition, not just at the physical level, but I guess mental, emotional, probably going forward spiritual level too. So thank you very much. I've enjoyed every bit of this conversation. So last word to you. How has this
Yes.
conversation been for you?
Thank you so much. It was such a privilege to be talking to you. I literally poured my heart out today. So it was nice sharing my little experiences, and also to all the listeners, especially those who are in their budding stage of making career choices. You all can always think about holistic medicine as well. So, yes, I think that's it. And of course, a big gratitude to you for having me over.
Thank you very much. Thank you for your time and coming over. So wish you good luck. Take care, stay safe, and wish you good luck with your cafe.
Thank you. Thank you so much.
Okay, bye-bye.
Bye-bye.
Thank you for your time today, my dear listeners. This is your host, Milind Agnihotri, signing off. Goodbye, take care, and stay safe. This podcast is for general information purposes only and should not be considered as a piece of any professional advice. Views and opinions expressed in this podcast are those of its guest. Creators of this podcast expressly disclaim any and all liability or responsibility for any direct or indirect, consequential or other damages arising out of any individual's use of this podcast. For feedback and suggestions, please write to wingsindia75@gmail.com. Thank you.